Okay, hello. We are in week two. This is breaking down coding cases. I am instructor Muriel Howard. We're going to be covering respiratory coding guidelines, hints, and tips. And here are the items that you will need this week: a respiratory diagram. One may be found inside of week two instructor materials. You need some pencils. I always suggest coding with pencils because it's easier to erase. Highlighters, and a copy of your week two coding test that is found inside of weekly materials folder. Okay, we're ready to get started. Um, we're going to start with the first four cases. I believe I have three or four cases to cover. And This is number one. My number one may be a little bit different than yours. My test may be out of order than what yours are, but it basically is the same information. My number one may be your number three, and so on. So just pay attention to which one I'm covering when you are going over this with me. Remember, you need your CPT book and your ICD-9. I forgot to put that on the list. Okay, so the first thing we have here is our preoperative and postoperative diagnosis. So, what I see are some areas that have been bold typed for us for easy abstracting. And The postoperative, I'm sorry, I crossed out the wrong thing. The preoperative diagnosis and the postoperative diagnosis are not needed because right now we're only coding for the CPT. Remember, always review what the question is asking you. So we're looking at what was performed and where. So in this case, the provider in the doctor's office used a laryngoscopic mirror, and at this point, this is considered a direct laryngoscopy. So in our CPT index, the main term would be laryngoscopy, and then you would look for the range for direct. And what you're going to see is that there is a laryngoscopy with excision because the provider removed a benign tumor. He pretty much made an excision of the lesion from the vocal cord. So at that point, that's pretty much all you need. You need to make sure that you have the words operating microscope, direct, which is not listed in the case, so I'll type it out for you. That's important. This is a subliminal word. And also excision of benign tumor. So that's pretty much it. Do not use a code that has more information in the case than you need. For instance, you may see some other types of excisions, for instance, mucosal mass or something like that. Do not use that code because that's too much information, and it is not documented. And if it is not documented, it did not happen. Okay, number two. Now we're focusing on the diagnosis, ICD-9 portion. We have our preoperative and postoperative diagnosis. At this time, since the provider actually did a diagnostic view of the vocal cords, a laryngoscopy, he now has a more definitive diagnosis. So we will not need to do anything as far as the preoperative diagnosis is concerned because the postoperative diagnosis has been established as tumor of the left vocal cord. Now, in ICD-9, you do not need a modifier. Even though we have the LT or the left of the vocal cord, we're not going to focus on that. We're just going to focus on the benign tumor and the place is vocal cord. So, on the table of neoplasms in the ICD-9 index, what you want to look for is the word larynx, because that's where the vocal cord is. So, when you get to neoplasm, go down to the word larynx, or you may even find vocal cord. I haven't actually looked at this one in the ICD 9 in a while, but from memory, I believe you can find the word vocal cord, but definitely you're going to find larynx. When you go there, make sure you pull your code from the column that says benign so that you can have the appropriate code. And that's pretty much all you need to do. You also want to cross reference that code, and that's pretty much it for number two. So remember, table of neoplasms, which is in volume 2 of your ICD 9. The main term is larynx, and the type is benign, or the column. I'm going to make sure I say column is benign. And that's it. Okay, moving on to number 3. Okay, we have preoperative and postoperative diagnosis and the operation performed. In this case, we're only focusing on the CPT, so we'll focus on these diagnoses in number 4. The operation performed is bronchoscopy, to look or view inside of the bronchus. So what the provider did was use an endoscope, and an endoscope, because the furthest point was the bronchus, the term has changed over to bronchoscopy. Okay, what he did at this point is that he actually did a procedure. So we know that a diagnostic bronchoscopy is always included in the surgical. So we're only going to code for the surgery or the procedure. Okay. Now we're going to have two codes for this particular case. He used fluoroscopic guidance. So in our main term, what we're going to do is go to the word in the CPT index, bronchoscopy, and then we're going to make sure that when we follow through and review the code range or the codes that it has been given to us, we need to make sure that we have one for, make sure we have the word fluoroscopic guidance in the scenario or in the code that we choose. We also are going to have one for brush washing. And we're also going to have one for just diagnostic. So the provider did a transbronchial biopsy, or biopsies of some lesions. So this is important information that also needs to be inside of the scenario that we code. I'm going to underline that. And then we need the word fluoroscopic guidance. And we also need a code for the brush washings. Now there is two codes that are very similar. One says cell washings, or cell washing is included in the code with the transbronchial, and then there's one underneath that says brush washings. In this scenario, I will accept either code simply because the cell washing is similar and very close to exactly what happened, as well as the brush washings. So as long as you have either cell washing or brush washing in the code that you choose, then you'll receive full credit for that. I noticed that there's a little confusion with, the exact one to choose, and many of you will choose the one that has cell washings, and some of you will choose the one that has brush washings because they're quite similar. Now, one of the things you need to remember is all of the codes that are indented under the standalone code also includes all of the information in the standalone code. So you should only have two codes. You're going to have one for the transbronchial biopsies and brush washings, and you also are going to have one for the diagnostic bronchoscopy. So those are two procedures. And if you read the case very thoroughly, which is something I'm not going over in detail, you'll see that there is two separate and distinct procedures. You also have to remember your modifier for multiple procedures. The first procedure is the most intense, and that will be placed first. The second procedure will be will have to have a modifier 51 for multiple procedures. And that's a little hint, a little note, sidebar note. So in this case, it's just asking us what our modifier is. And once you review the information, basically what you've gotten or gathered here, you're going to find what the modifier is for number 4. Okay, last but not least, we have our number 5, which is carcinoma of the right lung. We're dealing with an ICD-9 code. There's also a procedure done with this that I am not going to cover because this one is very similar to number 3. The only thing is that you have to pay attention to the terms. Lobectomy. Okay, so for our ICD-9, we have post-operative diagnosis. Since we do know what it is, we're not going to use any information from the preoperative diagnosis, just post-operative. So I am going to scratch that out. Our post-operative is carcinoma of the right lung. Okay, a carcinoma is a malignant neoplasm. So what you would do is go to the word, oh, remove that. We'll go to the neoplasm table. Neoplasm table in volume 2. Then you go to the word lobe or lung. The same thing, a lobe is a portion of the lung. That's why this procedure, when you get to it, is called a lobectomy. And then what you're going to do from there is go to the word lung. And then with that, we have malignant. Okay, and in this case, we have to pay attention to whether or not this is a primary malignancy or secondary malignancy. So let me review some information in the case to see if the patient had a previous malignancy in another area of the body. So how do you know the difference between primary and secondary malignancy is that primary malignancy is if this is the first time or the first occurrence. In the case, if there was another case or another time in the person's history of having a malignancy anywhere else in the body, then we would code this from the secondary column. So do not see I do not see anywhere in here where the patient has had a previous cancer. So in that case, it's okay to code it from the primary column. Okay, so that's pretty much it. If something doesn't make sense, if you need a little bit more clarification, then feel free to call or email me. I hope everything is clear. And thanks for watching. You guys have a great week.